Hello, my name is Carolina Ramos. I chose to do my project on multiple sclerosis, otherwise known as MS. I have a friend and coworker that was recently in the past 2 years diagnosed with MS, and she's one of the strongest people I know. She has really gone through a lot, and she's a nurse just like us, and it really inspired me to choose this disease process to go over because all she's been through and she maintains such a positive attitude just really makes me not want to complain about anything because she's so strong, goes through so much, and is so hopeful. And I knew what MS was, but I didn't know in specific the pathology and all the other clinical information of what went into MS. So it really wanted opened my eyes, and I wanted to learn more about it. So this was a good experience for me, and I can't wait to go over the rest of you guys with you guys. So let's go ahead and get into it. So what is multiple sclerosis, or otherwise known as MS? So MS is an autoimmune disease. Autoimmune disease means that it's a condition in which your immune system confuses healthy cells for bad cells and attacks it. So the immune system is there to protect us from different bacteria and pathogens that enter our body and to keep us healthy. So throughout immune diseases, not just MS, but any other immune disease, somehow the connections get mixed up and the immune system thinks that our healthy cells are bad cells. So our body is attacking our own body with autoimmune diseases. In MS, the immune system attacks the myelin sheath, which is what covers nerve fibers. And these nerve fibers is what helps distribute communication between our brain and spinal cord and the rest of our body. So when there's attacks on it, inflammation occurs, which disrupts the communication and causes issues that are caused, and MS happens. We can think of the myelin sheath as a coating on electrical wires. If the coating is bad and starts to shrivel away and disappears and it's not there protecting um, the electrical wire, then your electricity isn't going to work appropriately, and ultimately it's going to die and not work. So that's a good analysis between the two. MS is usually permanent damage to the nerves. Occasionally, there has been instances which is reversed in mild MS symptoms, but it's usually not the case. The case is usually it's permanent. And here we see an example. This is a healthy observation of nerve fibers, and here you can see where this fiber is exposed and it's not here, and the damaged myelin, and which causes lesions to occur, kind of like scar tissue forms on bad skin. All right, so what causes MS? So we don't currently know what causes MS. Scientists have hypotheses and think it might be due to some vitamin deficiencies, smoking, exposure to infectious agents, but nobody's 100% sure. It's been known that these other, right here, these instances is more prevalent in patients with MS, but like I stated, nobody really knows what causes MS in the first place. It is more common in women than men, and it's usually detected between the ages 20 through 40. Less than 1% occur in childhood, and approximately 2 to 10% after 50 years of age. It is more common in Caucasians than in any other race or ethnicity, mostly fair skin, and it increases your chances of having MS if a family member has MS, like an immediate family member, such as a grandparent, a mother, sister, uncle. The friend I spoke of in the beginning of the video, her mother has MS, so that right there already put her at a greater chance of developing MS, which unfortunately she did get around the same age as her mother, 28 years of age, I believe. All right, so Pathology of MS. So it's thought that the inflammation of the white and the gray matter tissues in the central nervous system in the brain due to focal immune cell infiltration and their cytokines are the main causes of damage in MS. Cytokines are released, which cause inflammation, not just to the brain, to other places in the body. Pathogen-associated molecules simultaneously bind to toll-like receptors on APS in the production of specific cytokines that include interleukin. Interleukin 4 reduces the pathological inflammation via increase of macrophages, also known as M2, and these macrophages are actually what helps repair damage, and due to this reduce of M2 due to the interleukin L4, activation of M1 macrophages is done, and M1 is the macrophages that actually promote inflammation. Glial cells destroy and trigger the death of oligodendrocytes, and oligodendrocytes is actually what helps generate myelin sheath. So without it, the myelin sheath is unable to generate and causes lesions to form on the nerve fibers, which is what causes MS. All right, so early symptoms. Symptoms vary. MS can attack anywhere on your spinal cord and your brain. So there's a vast array of symptoms that can form depending on what part of the brain is attacked. Some symptoms include vision changes, vertigo and dizziness, pain, numbness, fatigue, and cognitive changes. Right. Some late symptoms include you can either have one leg paralysis. Most of the time, it's bilateral leg paralysis, so both legs, dysphagia or difficulty eating and swallowing, bladder and bowel dysfunction. This can include dribbling, incontinence. Some people have urinary retention, which often leads to them having to have a Foley catheter. Some people for the rest of their life. Some people have to cath themselves. Depression, anxiety is usually already well endowed in these people due to so many years suffering from symptoms. And seizures is another symptom that they can have. Pathological process with symptoms. So one of the ones I chose was optic neuritis. My friend had optic neuritis, and that was her main symptom before she was diagnosed with MS. And she really had a hard time. She had constant pain, just in one eye, her right eye, and it was constant. She couldn't open her eyes. She couldn't work. She had to miss a lot of time off. So I chose to do this pathological process on optic neuritis. And optic neuritis is the most common, mostly with MS. Other things that include is diabetes, other autoimmune disease, lupus can cause optic neuritis, but it's mostly seen in MS patients. So with optic neuritis, the central nervous system attacks the optic nerve and it causes inflammation. So in this picture, we see a normal optic disc, and then we see the edematous optic neuritis optic disc. So here you can see it's clear here. This band here is inflammation. You can see how dilated it is here compared to here, and that's inflammation of the nerve. And here you can see it also when compared to here. So this red car is how a person without optic neuritis sees, and then this is actually how a person with optic neuritis may see, very blurry. It can't really, it's undistinguishable, the car, can't see colors very bright. This optic neuritis causes extreme pain in the eye. It's hard for them to move their eye. They only really have somewhat of relief is by not moving their eye whatsoever. basically just resting with no light. They're very sensitive to light. Obviously, this is very unobtainable. People have to work, have children, husbands, family they need to care for. They need to care for themselves and their activities of daily living. So living with optic neuritis is very hard and very painful. And in most average people, it takes about a month for it to pass. Most have to take medication, such as steroids, for the inflammation to go down. It's really hard symptom of MS to have. Another pathological process we have, as we discussed earlier, was paralysis, and this is due to the myelin sheath destruction and the lesions that form on the nerve fibers. So as the lesions form on the nerve fibers, especially in the spinal cord, it interrupts the signals from the brain and the spinal cord to your legs, and it's really hard for a person to move. So they end up becoming disabled, and they have paralysis in their legs. Most people with MS, when it progresses, are unfortunately wheelchair bound. I had a patient in the nursing home, and he could only move his head, and he could chew, and he could move his arms a little bit, but his legs, he could not move them at all, and he had to get around. We had to use a lift to lift him up and put him in the chair, and he used an electric wheelchair because even though he could still use his arms, they were weak. So environmental factors, scientists believe that these factors greatly increase chances of a person having MS. In studies, they found that over 50% of the patients that they chose had at least one of these factors with MS. So one of them is the Epstein-Barr virus, EBV, human herpes virus type 6, and mycoplasma pneumonia. So with EBV, this is usually associated with the herpes simplex virus, and usually a person will have this EBV in their childhood or in their adolescence or early adult life. And what scientists believe is that exposure to these bacterial agents and foreign agents, that EBV has a nuclear antigen that is actually structurally similar to myelin sheath. Because they both have basic protein, they both have glycoprotein and protein lipid. So when these immune cells are activated by these pathogens, the myelin sheath lesions form because they're so similar. That's one of the hypotheses that they have. Also, the stress of the virus on the body, they believe that can somehow activate the immune system into going into an autoimmune state and attacking its own healthy cells. This is not 100% proven. Like I said, these are hypotheses. Smoking is another factor that they believe increases the chances of a person having MS. Smoking affects pretty much anything, any disease. It's bad to smoke. But in MS, they believe that smoking interferes with your immunity, which increases your risk of getting the EBV virus, which ultimately predisposes you to produce autoantibodies. Also, the nitric oxide and carbon monoxide that forms from smoking is a toxic soluble gas that in concentrations can damage neurons and oligodendrocytes, which help aid in myelin sheath recovery. So as this is destroyed, it can't regenerate, which can tend to lead to myelin sheath lesions. Also, vitamin D and B12 deficiencies are often found in patients that have MS. My friend I know has a vitamin B12 deficiency, and she has to take supplementation for it. It's important because vitamin D helps aid in immunity, and vitamin B12 has a form of myelin shell component that helps regenerate it. So if you're low on vitamin D, your immunity is compromised, and if you're low on vitamin B12, your myelin sheath regeneration is compromised as well. So Those you can supplement. They have injections for vitamin B12 and vitamin D. You can take in supplements, or even staying a few minutes out in the sun will help with that. Okay, we have labs and diagnostics. So labs such as CMP, and other vitamin specific vitamin labs are done. They do these labs to make sure that you don't have any other diseases, that to make sure they rule out any other diseases before they can properly diagnose you with MS, because symptoms such as fatigue, you can have fatigue in any disease, so they want to rule out any other disease before they continue to try to diagnose you with MS. So it's more of a rule out than anything else. There's also a brain MRI. If they suspect you have MS, they'll do a brain MRI. And this brain MRI is the most accurate in looking for lesions. They also do spinal cord MRIs also. And then they also do lumbar puncture, also known as spinal tap, where they take some fluid out of your lumbar, and the fluid can show if there's any other diseases as well, such as meningitis, but it can also show abnormalities and antibodies that are associated with MS. So this picture here, you see a brain MRI of an MS patient. These are the lesions. A normal person would not have these lesions, a normal person without MS. And here I have a comparison side by side, a healthy brain and a brain with MS. And as you can see, in a healthy person, there's more space for the brain. There's not as much white matter. Here you can see how enlarged this is compared to this, and how much less space the brain has because the white matter has expanded. And this is a spinal cord with lesions on a newly diagnosed MS patient, and these are the lesions on the spinal cord, as you can see. Now, there are 4 different types of MS. First, we have the clinically isolated syndrome, also known as CIS. So this is when a first episode occurs for a person. The episode has to last at least 24 hours. Now, with CIS, you can or cannot have MS. Just because you have a CIS episode doesn't mean you have an MS. What puts you at greater risk of having MS is if you have another CIS episode, and if you have a brain MRI that shows lesions on your brain. That greatly increases your chances of having MS due to the lesions. Now, if you only have one CIS episode in your entire life, then you most likely did not have MS. You most likely just had a neurological episode. Early treatment of CIS episodes, though, on MS patients with positive lesions can greatly reduce worsening of the condition if caught early and treated on time with medications. We also have relapsing and remitting MS, also known as RRMS. So this is the most common stage of MS, where people have episodes and then they relapse, then they go into remission and then relapse and go into remission. So it's like a constant state. You can be in this stage of MS for years. Research shows that people can be in that stage for at least 30 years, of a few years of remission and then relapses for a year and then remission, and vice versa. Then we have primary progressive MS, also known as PPMS. So this is less common type of MS. Here the neurological function worsens very quickly as soon as diagnosis. There may be minor improvements, but usually there's no remission or relapses, and it usually starts from the beginning. It gets progressively worse very quickly. That's not that common, though. The most common is the RRMS. And then the final stage of MS is the secondary progressive MS, also known as SPMS. And this is where eventually patients go from the RRMS, the relapsing and remitting, into pretty much the worsening stages of MS. Most people here don't walk at all anymore, don't talk, have trouble swallowing, moving, doing anything for themselves. So this is the worst of MS. So treatments. There's different treatments for MS, mostly medications. Um, I have common med names here: cladribine, fingolimod, uh, siponimoid, sorry for my pronunciation, dimethyl fumarate. And these medications go in with the treatment, which is immunomodulating agent medications. These can help by inhibition of immune cells and activating the decrease of inflammatory cytokines. So they help decrease cytokines from releasing into the body, which cytokines is what causes inflammation in a person. We also have corticosteroids, which are commonly used in acute inflammation and help secrete pro-inflammatory cytokines, so the cytokines that help not cause inflammation. We have the mitoxantrone, which inhibits macrophage mediated myelin degradation and diminishes the production of pro-inflammatory cytokines as well. Then we have the mycophenolate, which inhibits immune cell activation and migration through the blood-brain barrier. And then last, we have methotrexate, which reduces inflammation. It's also a medication used for rheumatoid arthritis and also can be used for breast cancer. An invasive treatment that they're currently experimenting on is called stem cell treatment. So stem cell treatment is the transplantation to treat RRMS, which is the remitting and relapsing, which is the one that patients are usually have for the most amount of years stage, where they relapse and remit and relapse and remit. So this is to help them patients make more blood cells. Here the doctors give the patient a medication for them to help make more blood cells in their bone marrow, and then they retrieve enough blood that they need for the treatment, and then after that they are given very strong doses of chemotherapy to pretty much slow down the immune system. They slow down the immune system so that when they re-inject the stem cells, the immune system doesn't try to attack the stem cells and kill off the treatment. So that's why chemotherapy is given even though the patients don't have cancer. This showed in one of the trials that 69% of the people that had the stem cell therapy didn't have a relapse in MS symptoms or new brain lesions for at least 5 years after treatment. So 5 years after treatment, they did not have any new lesions, which is pretty remarkable because most patients get new lesions at least every year. So this has been a very positive and hopeful experiment and treatment. It does carry its risks though, because with chemotherapy and lowering the immune system, you are at greater chance, if you have MS, of contracting pneumonia or any other disease due to a low immune state at that point. Like I said, this treatment is still experimental. It is not FDA approved. It's still going through stages and needs a few more years of trials before it can be FDA approved. And there are my references. And that's it. Thank you so much for allowing me to present this. I am very appreciative and I learned a lot. I didn't really know the stages of MS or the treatment options or the stem cell treatment, so I learned a lot and I'm very appreciative for this project and thank you so much. And that's it, the end. Thank you again.